Tucked away in the rural town of Babbar-ruga in Katsina State lies the National Obstetric Fistula Center, a sanctuary for women afflicted with obstetric fistula. This center, a ray of light amidst the darkness of maternal health complications, offers a lifeline to the women across the northwestern part of Nigeria and neighboring countries, providing specialized treatment, care, and support to help them reclaim their lives and dignity.
National Obstetric Fistula Center Babbar-ruga Katsina is the second national center in Nigeria, the first one being the Fistula Center, National Obstetric Fistula Center in Abakaliki. But the Fistula Center in Katsina happens to be the first in Nigeria, but the second national center. We are the biggest, I can say, because we have more patients. We serve the northwestern part of Nigeria. The center was established on the 19th of December 2013 after the center was taken over by the federal government of Nigeria to become the National Fistula Center. The center, after establishment, we were mandated to offer free services to all obstetric fistula patients that are in the northwestern part of Nigeria, even though we are a referral center. So we receive patients from all over Nigeria and patients that come from other neighboring countries like Niger, Chad, and Cameroon.
Obstetric fistula, known as yoyon in Hausa, is an injury during childbirth in the birth canal. It is usually caused by obstructed labor, and each year at least 13,000 Nigerian women develop the condition. A beneficiary of the center who wishes to remain anonymous revealed that what started as labor contractions led to months of excruciating pain.
Na tashi da safe ina naƙuda. Kaɗan sai ƙarfe 2 ya fara yi sosai. Sai na je asibiti. Da na je asibiti sai suka ce min da sauran lokaci haihuwa ne. Sai suka samu ruwan naƙuda. Da suka samu ruwan naƙuda sai suka samu tablets. Kuma haihuwan farko da ne an min CS. Suka min inducing ɗina. Sai na zo kan baby ya fito amma naƙuda ya ƙi ci gaba. Sai muka zo aka canza mu asibiti. Muka koma wani asibiti. Sai aka min tiyata. Sai aikin ya zo ya lalace.
About 80 to 95% of the causes of obstetric fistula occurs when a young woman experiences prolonged obstructed labor and has no access to medical care. It occurs when the woman's pelvis is too small, the baby's head is too big, or the baby is badly positioned. If the mother survives, she is left with extensive tissue damage in her birth canal. Nigeria has developed and implemented 2 strategic plans to combat obstetric fistula since 2005. The 2019 to 2023 plan aimed to reduce the incidence, occurrence, and improve rehabilitation and reintegration of patients by 30% each. To achieve this, the plan proposed establishing at least one federal government-owned treatment center in each geopolitical zone, fostering intersectoral collaboration, implementing behavior change communication strategies, and scaling up access to comprehensive maternal health services for primary prevention.
We have 2 basic broad patients. There are those that may need resuscitation before actual preparation for surgery, that there are those that are actually clinically stable, that the main admission is to prepare them for their surgery. And then there are those that their own fistula may not require surgery, or probably their own may be urinary incontinence, stress incontinence following delivery, which is a little bit common nowadays. And those 2 group of people, we manage them by using intracervical catheter. And therefore, those that may not need surgery are admitted into the ward where we keep people that are for conservative management. The conservative management is also offered for the patient free of charge.
But the center not only provides medical care, it also addresses the stigma and isolation that these women usually face in society. Oftentimes, even after recovery, some women are shunned by their communities and even their families, leading them to feel shame and a loss of purpose. To tackle this, the center offers vocational skills training to help these women regain their sense of self-worth, enabling them to build lives beyond the physical and emotional scars of their experience.
The center consists of 3 functions. We have agronomship / entrepreneurship unit. We have psychosocial therapy unit, and we have the adult literacy unit.
Despite its proven successes, the center faces challenges in expanding its services due to an inadequate number of skilled surgeons who can operate and manage fistula cases.
Skills and expertise for the treatment of fistula in Nigeria is, I can say, is suboptimal because we have very few specialists. And based on the number of specialists that we have and the number of patients that we have on ground awaiting surgery, and the new patients that we have presenting with fistula, it will take Nigeria a very long time before we can say we'll eradicate fistula completely in Nigeria, because the skills are not there. Not many people have the skills to do fistula surgeries, because after graduation from medical school, doing residency program, one needs to come back and be trained on the skills to perform this surgery. So we encourage young doctors to come and learn the skills of doing fistula repair so that at least the number can be reduced significantly.
And despite the empowerment packages provided, some of the beneficiaries struggle to reap long-term benefits due to the economic hardship in Nigeria. Bashir, the representative of the center, revealed that some women, pressed to address their needs, sell the equipment rather than use it for sustainable income generation.
The nature of an average Nigerian man, if you give him something, if you are not lucky, he will go and sell it off. So we don't even tell them that the eco capital will give them. We don't tell them that it's free, we are giving you. Like the sewing machines, the knitting machines, we used to tell them that this machine we are giving you is on loan. It's not free. So we'll be coming to a place to monitoring our equipment.
But the fight against obstetric fistula exceeds improving maternal health care access. A concerted effort to address child marriage is equally important. Research has revealed that girls under the age of 15 are especially vulnerable to the condition, and community leaders in Babbar-ruga are keen into this, being at the forefront of tackling child marriages.
Da yarinya ai karama ake mata aure, wanda sannan mutane ba su waye ba. Amma yanzu mutane sun waye, saboda su kansu shugabannin asibitin nan suna bi lungu-lungu suna yin taro da sarakuna na ana wayar musu da kai cewa a bayyi ma yarinya aure bata isa ba, tana ƴar kararrama. Kuma yaranmu wanda aka yi ma auren nan an hore su da an maki aure in dai zaki fara samun juna biyu din nan, to ki rika ziyartar asibiti